Yes, hello, good afternoon, ladies and gentlemen. Welcome to another episode of Medical Myth Busting. I remain Dr. Lawal Abdulsalam. Today we'll be discussing something very special because it is World AIDS Day, which is known as HIV. HIV means Human Immunodeficiency Virus. It is a sad story, just like the last episode I talked about the sad history concerning HIV. So today we're going to look at what you need to do if you are HIV positive and what you need to do to protect yourself from not becoming HIV positive, and some of the misconceptions about HIV we're going to decipher them today. Now, first and foremost, when someone has HIV, it is not a death sentence if you are taking your medication regularly. It's just like someone who already have some other lifetime disease like hypertension, diabetes, whom will eventually develop complications if they are not regular with their medications and doctors follow-up. Now, if you are HIV positive, the first thing you need to do is to visit an HIV center where they will commence your antiretroviral medications. Antiretroviral medications they have different family of antiretroviral medications that can actually assist you to make sure your viral load is undetectable. Once your viral load is undetectable, what it means is you cannot spread this disease to a partner. You cannot spread this disease because the antiretroviral drug have knocked it to the extent that it is undetectable. Except you stop taking your antiretroviral drug, these viruses will replicate again and flood your system. Why is it like this? Because if only the antiretroviral drug could get to two sites, we call them the sanctuary site, the blood-brain barrier and the testicles, then would have a total cure of HIV. But unfortunately, these medications cannot cross to this region, and hence they only suppress them. And when you stop taking the medications, these viruses flood the system again. So as such, when you stop taking your antiretroviral medication, you can also develop AIDS, which is acquired immunodeficiency syndrome. So this is what exactly will happen if you stop taking your antiretroviral drugs. Now, it is important that when you are HIV positive, when you are taking your antiretroviral drug, it is very, very important that you should inform your spouse that you are having coitus with, because it is a criminal offense if you are HIV positive and you are aware and you deliberately infect your spouse. It is a criminal offense which many persons are involved. It is criminal. Don't do that. If you know that you are HIV positive, it is very, very, very important that you inform your spouse so that they themselves will not be infected. So this is what you need to do if you have HIV. HIV till now has no cure, but it is treatable. You live a normal life. You live a life like every other person, just as they will tell you HIV not the show for face. Many persons they are even carrying it. You are not even aware that they are HIV positive because it's not the show for face. So it is very important that you screen yourself for HIV. Now, for those persons who are living a risky life, one, they have multiple sex partners, two, they take and they share needles, three, they are gay, the men sleeping with men, they are at a very high risk of developing HIV. In fact, the risk for health workers is not as high as those persons who are men sleeping with men and those who have multiple sexual partners. In fact, a lot of persons who become HIV, 80% of persons who become HIV positive today, they actually got their infection, especially in our part of the world, from heterosexual, from sex, from vaginal penetrative sex. While most persons who got their HIV in other advanced countries like the United States and other countries that are legalized men sleeping with men, they are likely to get their infection from gayism. Okay, so if you are doing all this, it is important for you to do one, stick to one partner. Two, ensure that you use condom. Three, make sure you abstain from sex. Stick to one. Abstain. In fact, first thing is abstain from sex. This is the first thing. Then two, be faithful. Stick to one partner. Then 3, make sure you use condom. But unfortunately now, because of the fact that many persons are now involved in sex coitus, most people will not even tell you to abstain from sex. Rather, they will tell you use condom because of what the world has become. When you, in fact, everybody loves sex, so it is important that since you love sex, you are doing it with different partners. It is important for you to use your protective measure, which is what? Condom. Now, people do ask questions. Can HIV be transmitted via saliva? The answer is no. You cannot transfer HIV via saliva. You cannot transfer HIV via sharing of towels, but you can transfer HIV through sharing of needles, through coitus. Unprotective coitus. You can transfer HIV via this acts. Now, what are the infections that could likely, what are the symptoms that you could see when you likely have HIV? 1, different symptoms like, severe cough, diarrhea, skin lesions, and what have you. When you see all these, and oral lesions like oral candidiasis, when you see all these, and wasting, you start losing weight, then you start suspecting this could actually be acquired immunodeficiency syndrome. So thank you so much for your attention, and subscribe to my YouTube channel if you have not done so. Thank you so much. I remain your medical mythbuster, Dr. Abdulsalami Lawal, also known as Halal Doctor. Thank you so much for your attention.